Hello, and thank you for joining us at InfoNews Media TV, where we bring you clear, concise, and reliable news coverage every day. The region of southern Denmark has introduced a new initiative to address the shortage of general practitioners by offering medical students practical training opportunities. By placing students in internships within general practice settings, the region hopes to encourage more future doctors to choose careers as practicing GPs. This hands-on experience is intended to give students a better understanding of primary care and its challenges, ultimately strengthening the healthcare system. The shortage of general practitioners has long challenged the region of southern Denmark. A new agreement with the University of Southern Denmark in Esbjerg now enables medical students to complete internships with practicing doctors, expanding training beyond hospitals. They acquire essential insight into the daily care of typical patients, a crucial experience for every physician. The new internship program provides students with practical patient care experience, preparing them for careers as general practitioners. Jørgen Skodborg, chairman of the Organization of General Practitioners, welcomed the initiative, saying it will encourage more young people to become GPs. One day a week under the new agreement, students spend 1 day per week in a general practice clinic during their first 2 years. This hands-on experience with everyday patients is essential for a solid medical education, said Jørgen Skodborg, chairman of the Organization of General Practitioners. No concern over initiative. The Esbjerg Medical Program, started in 2022 to boost doctors in southern Jutland, graduated its first 21 students last week. 8 will stay to work locally in hospitals or psychiatry. This improvement is expected to encourage more young people to pursue careers as general practitioners. Even if students choose hospital work over general practice, the Organization of General Practitioners sees no issue. They still gain valuable insight into everyday patient care, said Chairman Jørgen Skodborg. The region of southern Denmark expects 5 students to start general practice internships this September, rising to 50 next year, with hopes of at least 10 students per cohort interning in clinics. How extensive is the doctor shortage? Denmark facing a shortage of doctors, 2014. Denmark was expected to lack 5,500 doctors by 2035, according to the Young Doctors Organization. While the Health Authority estimated 28,000 doctors by 2035, the organization argued that more than 33,000 were actually needed. dsr.dk, cpoppost.dk. Doctor shortage or rationing, 2008. Professor Finn Gintelberg discussed how the shortage of authorization numbers creates artificial doctor shortages, suggesting free choice, granting authorization numbers to all specialists, and more autonomy in general practice. ugeskriftet.dk. Health Authority, doctor shortage will be a big problem, 2006. The Nurses Journal reported that 3% of practices were already empty, with only 56 authorization numbers available, and forecasts pointed to increasing shortages toward 2015, dsr.dk. Mapping doctor coverage in Denmark, 2015. An analysis from the Association of Local Governments showed that especially Northern Jutland and South Zealand had overburdened doctors, and that 30% of general practitioners were aged 60 or older, a recipe for bigger problems ahead, kl.dk. Health reform could worsen the shortage, 2019 PhD Mads Toft. Christensen warned that more training positions without geographic control would worsen rural challenges. Well-established urban regions would get more doctors, while sparsely populated areas would not. ugeskriftet.dk. Denmark lacks 2,000 specialists, 2025. The Danish Medical Association's chair, Camilla Noel Rathke, highlighted the current shortage of specialists. The lack of 2,000 specialists affects treatment of dementia, arthritis, and mental illnesses. Lager.dk. Reactions from doctors and the public-verified Reddit comments show there is a shortage of specialists, not young doctors. For many years, attempts have been made to alert politicians, but we increase internship positions. Doesn't win votes. Reddit.com. And since there is a shortage of specialists in general practice, It's hard to sell the least profitable clinics' authorization numbers. Reddit.com. In summary, doctor shortages in Denmark have been a persistent structural issue, resulting in longer wait times, declining coverage in rural areas, and extensive public and political debate on how to train and retain doctors, including incentives, organizational, and geographic solutions. Thank you for watching InfoNews Media TV. Stay informed, stay engaged, and we'll see you again soon.